Okay, many of us have seen on television some programs where they talk about children dying in African regions, some of the countries there, because they're malnourished, or they're dying from starvation. But I want to talk tonight about a disease. It's called malaria. That is also a leading cause of death in some of these sub-Saharan African countries. Malaria is a disease it's a blood disease. It's caused by the Plasmodium parasite. It's transmitted from human to human through mosquitoes, specifically the female Anopheles mosquito. Now, I don't know how liberty that mosquito is, but it does like to bite and carry this parasite. Today, there is currently no vaccination for malaria. There are a couple of things that are in the works right now that have some pretty good outcomes so far, but it's probably still years before we'll have a vaccination for malaria. Symptoms of malaria are very much like the flu-like symptoms that we experience here with viruses and so forth. Fever, aches, pains, chills, headaches, all of those are common with malaria. You start with these symptoms about 8 to 25 days after you've been infected by the mosquito. The thing that's a little different from the flu that we're commonly used to is that there's periods of time between the flu-like symptoms that you feel better. So I may have the flu today, or feel like I have the flu today, and feel much better tomorrow, and then the next day or two, I feel like I have the flu again. And so that's one way that you can distinguish malaria symptoms from flu symptoms. Malaria is a very old disease. It's been around for 4,000 years. In fact, it was recently determined that King Tut, who was 19 years old when he died, had malaria. In the 4th century, there's documentation from Greece that says entire city-states were eliminated because of the disease. In the early 20th century, in fact, in 1906, many of us may remember from our history books the building of the Panama Canal. The building of the Panama Canal was heavily impacted by malaria. In fact, in 1906, there were 26,000 workers working on the canal. Of those 26,000, 80% of those were in the hospital in 1906. So very high incidence of malaria. Obviously, the countries working on that, the United States and the other partners, were very concerned about the toll of malaria. So they started looking at ways to prevent malaria. They looked at making sure there was plenty of medicine available to treat the patients that had malaria. And then by 1912, there were 50,000 workers working on the canal. And of the 50,000, only 11% went in the hospital in 1912. So they made huge strides in the prevention and treatment of malaria at that time. Now in the United States, we had malaria here as well. In the Louisiana area, the Tennessee River Valley. And we took what we learned from the Panama scenario and applied more funding and started attacking malaria here in the United States. And by 1951, it was considered completely gone out of the United States. So it can be eradicated. But tonight I wanted to talk more about Africa and malaria in Africa. In the Democratic Republic of Congo, or DRC, which is this little, well, it's actually a big country there in the middle of Africa, there's nearly 200 children that die each and every day from malaria. Recently, the World Health Organization published an article that said that in 2010, there were 660,000 deaths across the world due to malaria. Now get this, of the 660,000 deaths, 90% of those happened in sub-Saharan Africa. So all this red that you see here in the continent of Africa, those are the high-risk areas of malaria. In addition to the misery associated with malaria, if you have malaria, it also has a huge economic impact on those countries. There's loss of work time, people that can't go to work if they're in the hospital or sick with flu-like symptoms. There's a cost related with the actual medicine and the tents and things that they use, mosquito tents that they use. There's also a lack of foreign trade, foreign investment and tourism in these countries. There's not many companies willing to invest a lot of infrastructure or move a workforce to a country that has a real high incidence of malaria or an epidemic of malaria. Families overcompensate because in their birth rates. So there's overpopulation in some of these countries. Many of these families assume that they have to assume that they may lose one or maybe two of their family members to malaria, so they have large families. There's also an impact on the cognitive development of some of these children. If a child has had malaria multiple times, these parasitic cells adhere to your brain cells. And so it impacts the learning and development of some of these children. So you end up with a population, part of the population that's not very well educated because they've been impacted by what they call brain malaria. The good news, as I said before, is that it can be prevented. Some of the things that have been done that has been very helpful is they've supplied insecticide-laden mosquito nets. Now, the other thing that they have to do is train them how to use those nets. Unfortunately, when they first started distributing these nets, they didn't explain how to use them, so that still people were getting bitten in the night by the mosquitoes. They're trying to correct that now. They also spray the inside of their homes, the walls. So a mosquito lands on the wall, they get infected, or they take in some of that insecticide and they die. Education about standing water around their homes. As we all know, if you have standing water, that's a breeding ground for mosquitoes. So training on creating drainage systems. Obviously education and awareness, and which you wouldn't think is that big of a deal, but it really is. There needs to be door-to-door communication to some of these families. And then access to diagnostic tested medicine. Having those readily available. Some of these families that have to go to a clinic to be treated, it's a day's trip for them. It takes a day to get there, half a day to get there and a half a day to get back. So what can we do? In 2006, there was a nonprofit organization called Nothing But Nets. And its sole purpose was to raise money to provide these mosquito nets to regions of the world, not just Africa, but other regions of the world too, but primarily focused on Africa, so that they will help in the prevention of these mosquito bites. They've been very successful. Since 2006, there's been over 7 million nets distributed. Those people that are working on the Nothing But Nets also realized that they needed to do more. There was more education that needed to occur, there's more awareness that was needed, and so they started a campaign called Imagine No Malaria. Imagine No Malaria has been in existence for the last couple of years, and it includes Nothing But Nets, but a lot of other programs that help with the education and training in these regions. It's a lot like Train the Trainer. They're going into the community, training individuals that then can train others within their own community. So tonight, I'd like for you to think about a world without malaria. And I want to thank you for your time. I've included some websites here that may be useful for you if you'd like to learn some more information about it. The last one is a golf tournament, actually, that's being held in Little Rock. If you're interested in it, it's a fundraiser for Imagine No Malaria. Thanks again.